Pre-implantation genetic screening. It is a process that is like you can see it in the word only that I have spoken. It is pre-implantation screening. So pre-implantation means you're screening those embryos before they are getting implanted. So obviously if you're doing a PGS, it can be only run in an IVF lab because here there's the place that we create embryos. So these embryos are basically screened. They are screened before your implantation. So the indication for doing PGS, pre-implantation genetic screening, is either the patient has got he or she himself has got some karyotype problem, means some genetic problem. Secondly, they have had some previous child who has had a genetic defect. So now to be doubly sure, now they get those embryos screened before transferring it. Thirdly, they are patients of recurrent miscarriages or they are recurrent implantation failure. Because if you have recurrent miscarriages, we say that the nature has only eliminated those embryos. But if we have created those embryos and the patient is having recurrent implantation failure, then we really don't know that where these embryos are having some mutation or not. So in these cases also, it always better to screen those embryos. It is better to do a single embryo transfer rather than to transfer these anomalous embryos in a patient who is not going to conceive again. So basically, pre-implantation genetic screening should be done in patients who have got a history of genetic anomaly or recurrent miscarriages or recurrent implantation failures. But there is a risk that when we are doing PGS, there is a risk that maybe all your embryos will be defective. They come out, the result comes out that all the embryos are defective. In those cases, we have to discard all the embryos. So this also happens when a PGS is done. But at least the patient doesn't end up having the trauma of these embryos getting transferred in her womb. So it is a big respite. It is a big respite for all those couples who come to know about anomaly in a child when the fetus is 12 weeks, 13 weeks, 14 weeks. Then they have to go for a DNC, an abortion. And that is very much mentally traumatic to the female, her body, physically, financially, everything, for the couple in fact. So in these patients also PGS is a boon. So they don't have to go for recurrent DNCs. At least they get screened and they come to know that, look, all my embryos are being made bad. So look, I need to take a donor or I need to go, whatever needs to be done, that needs to be addressed and done, and that needs to be discussed with the IVF specialist that you are seeing. So PGS should be done in various cases, and with this they can take a good baby home.
यदि आप इस तरह ही हेल्थ के बारे में जानना चाहते हैं तो सब्सक्राइब करें ये चैनल द हेल्थ केयर टुडे और बेल आइकन दबाएं ताकि हर नए वीडियो का नोटिफिकेशन सबसे पहले आपको मिले।